Rachel Waranowicz is a patient here in San Diego, and she is on vacation somewhere sunny, right? Very sunny, so she's getting different sunshine than we have here today. But she still was kind enough to record her talk for us. So here we go.
My name is Rachel Waranowicz. I'm a 34-year-old female patient of Dr. Sue's. My husband and I have medical insurance through Covered California and selected the Blue Shield of California Platinum HMO Trio plan, with UCSD being our medical group. I was diagnosed with stage 3 grade 2 neuroendocrine cancer of the duodenum in June of 2023. And I underwent a partial gastrectomy, duodenal resection, and lymphodectomy in November of 2024. At this time, I've had no further treatment, and I'm continuing to be monitored through CT and MRI scans. Now, not knowing what the future holds health-wise for me, and having not had children yet, I began seeing Dr. Sue through a UCSD referral to learn more about oncofertility preservation and to discuss what my options were. My husband and I decided to move forward with an attempt at embryo preservation, which began our journey of navigating the complex Blue Shield of California insurance through Covered California and our Trio HMO plan with UCSD. So today I'd love to talk to you kind of about the current climate and challenges of pursuing oncofertility preservation coverage from a recent patient perspective. My first point of note is a lack of fundamental knowledge and of not only fertility preservation, but the new state mandate of oncofertility coverage by insurance providers. I cannot emphasize enough the frustration and lengthy, convoluted communication web that I endured to see this through. I had over 16 communication attempts, not including the times I couldn't get through or was disconnected, over a 5-month period from call number 1 with Blue Shield to starting my actual fertility preservation process. Now, the initial calls with Blue Shield gave me inconsistent answers each time, solely dependent upon the phone operator. I was also ping-ponged back and forth between Blue Shield and UCSD, with each saying I needed to get answers from the other. Now, one phone operator from Blue Shield did say that I should be able to get coverage with the new bill as long as I could get a referral, but was unable to give me any more information on their end. The other 2 operators told me that I didn't have coverage and I couldn't get my questions answered. The main overarching problem was that no one at Blue Shield or UCSD could locate a fertility clinic that was in network for me. This prompted me to message Blue Shield as I wanted firm answers in writing. My first response from Blue Shield stated that I did not have and could not get coverage. I then filed a grievance, and after waiting a month, received a response stating that they had previously given me wrong information and that I could get coverage with a referral to a fertility clinic. Now, I'd already received a referral from Dr. Sue at UCSD to see her at her out-of-network clinic. So this time I got a referral from my primary care doctor as well. Now, at this time, the financial team and nurse at the fertility clinic took over communications with UCSD on my behalf to get a prior authorization and a letter of agreement, which took approximately 1 to 2 more months. Now, the second major barrier for me in this process was a lack of access to benefit information and misinformation online. The Blue Shield website is not easy to navigate or find my specific benefit information. My summary of benefits PDF that I finally found only said not covered under infertility services. Then I followed all of the HMO Trio links on their website, and I only found information posted from 2023, so a year too old. One page titled Infertility Services indicated that I need to contact my primary care physician for a referral, which I had tried numerous times, but no one at Blue Shield or UCSD could locate anything in network. It also stated that all plans were entitled to various fertility services listed, which is in direct contrast to my summary of benefits and the phone conversations I had. I also was led online to an infertility services rider page, which turned out to be only applicable to Stanford University employees. All of this varying and out-of-date information was extremely confusing to navigate. Communication with my medical group UCSD was also fairly difficult, as the phone number provided to me was a general UCSD line which would continually have me transferred, rerouted back to where I started, or even sometimes disconnected. So you can see how frustrating and lengthy this process was. The third huge obstacle was that the insurance in the end did not agree to cover any of my medications. Since there are no alternative medicines and the process cannot be done without them, how did insurance fully follow this mandate? At best, this coverage that was given to me brought the treatment costs down, but it still didn't make it nearly affordable or accessible to the majority of the population, which is the goal. For one round of attempted embryo preservation, we've paid over $16,000 out of pocket at this point, which is more than double what our estimate had been. And at this time, we're unable to move forward with any subsequent attempts, with cost being the major reason for that. Now, my fourth main point, and lastly, is that time, unfortunately, is not on the patient's side. It took me 5 months to get a letter of agreement. I'm lucky. At present, I don't have any further treatments that need to happen quickly. But what does a patient who needs to start chemotherapy urgently do, especially if they can't afford $25,000 plus out of pocket up front? Who can in this current climate? How would a patient unable to think clearly, emotionally distraught, or unable to fiercely advocate for themselves be able to successfully navigate through these hoops? Simply put, I don't think they could. Now, looking to the future, I hope that UCSD, as the managing healthcare organization for the HMO trio, will establish an in-network fertility center so that a letter of agreement will not be needed. I also hope that establishing a direct phone line for the medical group to answer insurance questions can be added. Adding and advertising up-to-date resources to UCSD cancer care page, such as the Fertility Preservation Bill, is necessary to open access to those who have not been told about it by their doctor. The simpler and more streamlined information can be accessed by cancer patients, the more helpful it will be, and the more likely services will be used. I know that having patient advocate and support services readily available, which did not require pre-authorization and hoops to jump through, and if they had been communicated to me by my providers from the beginning, would have been very helpful. I also think that if there's some way that cancer patients could be automatically flagged for communications and grievances to be addressed on an expedited timeline, I think this could really improve the communication efficiency. Finally, I'd really like to suggest recorded communication logs, including phone calls on both the insurer and medical group level that are accessible to patients in their portals. This way they can see where they are at in the process, any inquiries that have been addressed on their behalf, and what their financial obligations are. So thank you so much for your time and listening to me today. I look forward to the positive changes that come from people like you who are trying to make a difference.